Hi, Brenda. How you doing? This is Gina North. I'm coming to you from Washington, D.C. I hope you had a really good weekend. I just want to say I really enjoyed your post. I thought it was very thorough, and I like the studies that you pointed out. So the first study that you talk about for your medication-assisted therapy to help manage opioid addiction is this one by Boltayep. Boltayep, yes, 2012. And he points out that the clinicians a lot of times rely on patient responses to assist with the dosaging of the correct dosage for either buprenorphine or methadone to decrease the withdrawal and craving and decrease the side effects. So the dosage is really important. But I really enjoyed the second study that you pointed out, and that's from Chow, Corthius, Weimer from 2016 et al. So there's more of them. And they come up with a model that, in my eyes, would be very effective if you could actually do this, if you could actually get through all four of these aspects. So there are four aspects to it. The first being the pharmacological therapy of the buprenorphine and the methadone. And then, of course, everybody also talks about Narcan. So the first two will latch onto the brain receptors, the mu receptors in the brain, and produce an overall opioid effect, but lessen the side effects. And in a controlled environment, hopefully you could be able to do less and less of these medications, and then in that way wean the person forever. Narcan, on the other hand, is an opioid antagonist, and I don't know if they prescribe Narcan, but I know that Narcan works immediately to reduce the effect. So this is very effective in somebody who's already overdosed. I've seen it in action. It works. It's an amazing drug. People look not alive, and you give them Narcan, and all of a sudden they just get up and walk, and they're fine. So the second aspect is a psychosocial aspect, which means counseling and psychotherapy. So that study by Sheridan, who says in 2017, and she was the one that says you don't really need it because the outcome for MAT is going to be the same whether you do psychotherapy or not. This model does say, go for it, do some psychotherapy, do some talk therapy, and I would imagine that that this constant push for what are you doing, why are you doing it, makes the person be aware of what they're doing a little bit, even though an addiction in a brain is probably overrides just being able to talk about it. Otherwise we wouldn't be here. It'd be too easy to fix. So the other one is integration of care. And this one is very important. I'm interpreting integration of care, meaning integration of what else is going on medically with that person. If you're going to put this in a primary care setting, somebody should be watching the rest of what the body is doing. Like who's watching the blood pressure, who's watching the kidney function, liver function, who's watching is this person developing diabetes or thyroid problems. And so putting this in the primary care setting is probably a great idea, even though I must tell you, I work in a primary care setting right now, and they hate it. Primary care providers do not want to deal with this. This, they feel, should be left to the specialist, and they don't want to have this. I think it's a great idea. I mean, I'm all for integrating everything because you have the same person watching what else is going on with the whole body because of this addiction. But I can understand also the providers feeling that they're not properly trained. So the last one that you point out is provide this ongoing education. That kind of goes along with the psychotherapy. You educate, make somebody be aware of what's happening in their body, make them be aware of what's happening in society, make them be aware of what's happening in their family and with their relationships, and that should be ongoing. You also point out some various challenges, like the availability of professionals being able to do this, and the community and reimbursement. Those are all complicated things, and that's for the next post. Thank you. Great job.